Hello guys, DIPSI, DIPSI, which stands for Diabetes in Pregnancy Study Group of India, is a final year MBBS 5-mark question which most students till date are confused with. Like when to do it. See, DIPSI is both screening and diagnostic tool to detect diabetes mellitus in a pregnant woman in India. Basically, DIPSI is an Indian adaptation of the foreign guidelines given by ACOG, ADA, etc. So, when to do it? First of all, when does the foreign guidelines suggest you to do it? The entities like ACOG and ADA, they suggest the glucose tolerance test or glucose challenge test to be done in 24 to 28 weeks of gestation. Why? Because in pregnancy, in those weeks, the resistance to insulin is at its peak. But what DIPSI says, we will not wait till 24 weeks. We will do this screening test in the first visit of the patient. Why? Because India is the diabetic capital of the world. Any person you touch, he or she is almost diabetic until proved otherwise. That is one reason. And the second reason being, if you see the patient in first trimester, if you ask her to come again in 24 weeks or 28 weeks, there is a little chance of patient being compliant. You may miss the patient in follow-up. Okay, this is one thing. And the second thing is the foreign guidelines like ACOG, ADA, etc. They prefer the patient to come in a state of fasting for at least 8 hours to get the accurate reading of her glucose tolerance. But in India, if you see a patient today, if you ask her to come tomorrow in a state of fasting, you may lose the patient in follow-up. So you catch hold of her whenever she comes to you on the very first day and do the test. So according to DIPSI, you do the screening test for diabetes in pregnancy in the very first visit in first trimester, irrespective of the state of fasting. If you see that the test is positive, either GDM or over diabetes, you label the patient. If the test comes out to be negative, you repeat the test again at 24 to 28 weeks of pregnancy as suggested by foreign guidelines. So, DIPSI guidelines suggest that patient need not be in a state of fasting to do this test. I hope this video is clear. Follow for more. Thank you.